Welcome everyone to this Vulval Pain Society Research Results Special. Thank you for joining us live or on the replay. Please say hello in the comments and let us know that you can hear us okay, you can see me okay. Just say hello or say where you're from or throw an emoji at me. I'm Sheren Gaulbert, Vulval Pain Society Trustee, Pain Therapist, Clinician Coach and Pain Science Educator. You can, as we go along today, also pop your comments or questions for our guest in the box as we go along. That's an evening from, that'll be Catherine from the Vulval Pain Society in the background. Megan, hi. Megan, I hope I'm pronouncing your name correctly. It might be Megan. Back in May 2022, we had our guest on the first time that she came on, and now we are delighted to welcome back with the results and implications of her recurrent thrush study, Tori Ford. Tori, lovely to see you again.
So nice to see you. Thank you so much for having me.
We're so excited. So Tori, DPhil researcher, University of Oxford, you're a founder of Medical Herstory, and one of the things I remember loving about your study is that you made a space to hear patient voices. And that's all too important. We can sometimes get stuck in certain ways without hearing the people who are most important to the care that we deliver. Now, before we go into the results and some more exciting news that you have, can you remind us how you came to focus on this area of recurrent thrush?
Definitely. Yeah, so I'm a firm believer in patient stories, and this project actually starts with my own. So living with chronic vulval pain for the past coming up on 10 years now, and hearing a lot about sort of recurrent thrush and going down that diagnostic pathway and seeing firsthand a lot of the challenges with it, a lot of the misunderstandings that seem to exist within healthcare of it often being treated the same as just a one-off experience and struggling to be heard of saying something different's going on here. And I think we need to be looking into it. And then starting to share my story with other people. So in addition to doing my research, I also run Medical Herstory, which is a storytelling social impact organization. I shared my story there, and then people started sharing their own stories. So we've done a lot of work about, medical shame and stigma, centering patient voices, and then bringing research into that to make real change.
Brilliant. I love that it started from your own story and it was a driver to helping other people's voices be heard. I know that you have a presentation to take us through, so taking us through the results of the study, and then we can jump into any questions people may have. Does that sound okay?
Yeah, perfect. And definitely questions in the chat, really welcome. Happy to hear what you think of the results, things that are interesting, surprising, confusing, and we can jump into all of that.
Perfect. Brilliant. So you've got your slides there. If you want to just pop them onto the screen.
Are those visible yet? Oh, perfect. Great. Awesome. So thank you so much to the Vulval Pain Society for having me back and for playing a really key role in helping raise awareness about this study and get some of the participants aware that we were doing this research so that they could share their experiences with us. As was said, I'm at the University of Oxford doing a DPhil in the experiences and challenges with recurrent vulvovaginal thrush. And this study was all about patient voices and using them to create impact. So a bit of a refresher, if this is a new topic to you, or if you're one of these people like myself who's struggled with recurrent thrush, it's an all too common condition with over 1.2 million people in the UK suffering from recurrent vulvovaginal thrush. We know that it's one of these conditions that has long-term negative impacts on people's mental health, their sexual relationships, and their workplace finances, so many different aspects of it. We know that it's a condition that's rooted in shame and stigma, which makes it hard to talk about and seek care. And then we know from groundbreaking reports like First Do No Harm or the Women's Health Strategy for England that too often when people do make it to the doctor's office, they're told that their debilitating pain is normal or natural. We know that recurrent thrush is also difficult for healthcare providers to manage because it overlaps with so many other chronic and recurrent vulval pain conditions, and that there's a lack of research and online resources about how to understand these conditions and what we can do about them. So like I said, recurrent thrush, you may have different levels of familiarity with it. About 75% of people with a vulva will experience thrush at least once in their lifetime, with symptoms of itching, burning, and changes in discharge that affect the vulva. So that's the outside of female genitalia, and the vagina, which is the internal canal. And thrush, most cases can be self-managed, over-the-counter treatment, and it'll go away within a week. But what we see with recurrent thrush that affects about 6% of people worldwide is that this experience of discomfort and embarrassment becomes a recurrent issue, coming back, whether that's every few weeks, every few months, but at least 4 times a year is sort of the understanding of the definition. But people had varying experiences with this. So what did I end up doing with the study that I introduced a few years ago now? It started with a systematic review of scoping out what's known about recurrent thrush. What do we know works with it? What doesn't work? And how are people finding that information? I then sought to speak to patients to learn about their experiences, and I ended up talking to 34 people, including women, but also some trans, non-binary, and genderqueer folk as well. And then brought those findings to healthcare professionals, so people working across different professions, but in primary care, in GP practices, and sexual health, and asking them what they thought some of the tensions were and how we could create improvements. And then all these results are put into our online module, which we will get to very soon, which I'm very excited to share about. So the project took 3 years, and I'm so, so grateful to our participants that shared their story with me and contributed to the project, as well as our amazing group of patient and public representatives. So people with lived experience of recurrent thrush and vulval pain that helped guide this study from the very start to make sure that it was inclusive, that it was accessible, and that it was really targeting the people who needed it the most. And I'm so excited to share today that we are officially launching this online resource that's on the Hexi platform, and it's all about recurrent vulvovaginal thrush. This platform has over 20 topic summaries or web pages that tell you about everything with the recurrent thrush experience, from signs and symptoms to diagnosis, getting examinations, having swabs, the impacts on emotional life, on sexual life, hobbies, sports, finances, and then different treatment options, what worked for people, what didn't work for people. And then there's a lovely section, which might be my favorite, that's patients sharing their advice for other people living with this condition, and also sharing their advice for healthcare professionals. If you're interested in checking out the website, I highly encourage you to. It features real patient voices. And as you can see here, this sort of maze imagery, we'll play the video in a second, but all of the images on the website were actually co-created with participants. So what that means is that we didn't want to draw a generic stock image of a piece of fruit or a flower and really sanitize people's voices. What we wanted to do was have imagery that they saw their story represented visually, as well as through the stories they were using through words. So that was amazing work that we did with the help of a graphic designer to bring people's stories to life. And they had impact in seeing the rough drafts to adding colors and choosing what the movement would look like, and then seeing the final product. Also, as you'll see on the website, there's also video footage of the interviews where people have been willing to share their stories and their faces. And it's a wonderful way to sort of break down the stigma, as I love to do in my work. The more that you can say, hey, I'm someone living with chronic vulvovaginal pain, and I'm not ashamed, and it's not dirty, and I'm able to talk about it, is really impactful. And I've learned that the more you share your story, the more it makes other people feel okay to do it for themselves. There's also text clips from people that didn't feel comfortable being on video, because we wanted to make sure everyone was included. And then the audio as well. Some of them are actor recorded, and some of them are the real patient voices. So that'll be indicated. But this was a labor of love, and we wanted to make sure that with the study, we weren't doing that academic thing of just putting out papers that are written in really fancy language and or even struggle to understand myself sometimes. We wanted to make a website that was really accessible for the general public to navigate. And basically, this website is everything useful I found in the past 3.5 years of my PhD made publicly available. So we're going to share the link to this, and we're also now going to share the montage clip, which is at the opening of the website. So I'm going to do my best to get this to show, but I might need some help getting to the website. Perfect. Okay, so if I play that on my end.
Fingers crossed.
Yes. Is that playing?
It's not playing that we can see. Okay. And it's we can't quite see it. Could you try again?
Yes, no problem. I'm pressing play on the actual. Should I press it on this? 1 second.
We will be sharing the link to this later on, so people will have access to it. Is this where people will find the module as well?
Yes, so I can drop the link to it now and give people a few minutes to engage with it.
I've got the link here. I can pop it in the comments.
Let me try.
Stay with us and let's see if we can get it working here.
Perfect.
And I'll pop it back in.
Yes.
I guess the realization that it was a recurring thing was I remember when I first got it, when I was a teenager, and reading like the NHS webpage about thrush and reading the sentence at the bottom, and it was like, some people experience recurring thrush, and thinking like, oh man, it must be awful to be that kind of person because this is really horrible. And then I was like, oh, this is me a few years later. And I was a bit like, I guess I'm quite an optimistic person. And I just thought there'll be some way of sorting this out. Like there'll be a treatment, there'll be something that we can do.
Just to check that is playing correct. Perfect. And I might make it bigger then if you can just let me know.
If I had it once or twice in my life, yeah, it'd be uncomfortable. But the fact that when you get it recurrently, when you get it every month, it's a completely different condition in my eyes. I think they should almost be treated completely separately and not related. Because thrush is bad on its own, but how you have it like so consistently, it's another kettle of fish. It's just horrendous. It's a completely different thing.
Yeah, it's not severe. I think now, it can be uncomfortable and not nice, but I don't think I remember the earlier experiences with thrush being really quite severe and horrible and really not nice. Really sort of like burning, red raw, split skin, really not nice.
I mean, I'm pleased it's easy to buy over-the-counter treatment, but I am, genuinely slightly horrified by the amount of over-the-counter treatment I've taken, because also the check is like I lied constantly to people in boots who were like, "Oh, have you taken this pill in the last 6 months?" No. I would have taken it like 3 weeks before. I just wanted to have it again. And I think I've probably taken that pill like way too many times.
Getting an appointment was quite difficult, but once I did, the GP were sort of understanding, but I had to have a real conversation with them, and I could only do that when I was lucky enough to get through to a female GP, and they were quite reassuring, but it's always a different one, so I couldn't follow my case up with one person. Then I felt like I had to go through it all again with the next one and explain the whole situation, and trying to get on track and look at, I have got recurrent thrush, and then it's like, oh yeah, we've got to swap again, and I had to go through it all again with the next new one. Does that make sense?
So I thought they would have seen this a million times before because of how common it is. I thought they would know exactly what was going on. I thought that after prescribing me fluconazole for like the 4th, 5th time, somebody would have realised, okay, this is not working, and there needs to be more testing done here to figure out what's going on, or to at least understand the wider picture as to why I'm so susceptible or vulnerable to them. But there was no kind of support.
It just felt like I was in a never-ending cycle of woe. Like I said to you, I stopped dating. Didn't want to be around or have any sort of sexual contact with guys or anything. So I just literally shut down and stopped going out as well, because I was so uncomfortable at times. And trying to explain to people that at the time it was just, I didn't want to go into why I was feeling so uncomfortable.
People do feel like it makes them less woman in the way that a lot of men in system with erectile dysfunction can feel like they're less manly for it. I do think a lot of people with something like thrush might feel that's like that stereotype of like, oh, pristine conditioned woman. But I do think that being non-binary is kind of meant that I didn't particularly care about that to begin with. So that's not necessarily a statement that happened. But like, I'm less worried about it I'm not worried about it from that angle.
Well, it's changed my life really, because that's how bad it kind of was. And yeah, just getting in the way of everything. Whereas now I feel like I have more control, which is kind of what I wanted, I guess, when I was going to the appointments. That's what I was like asking for in the end. I was like, I need control of this. Like, this thing is controlling me. Like, I don't know what more I can do.
I'm glad we got that to play. So that is sort of the montage video, just giving you a bit of a taste of what information is on the website, and getting to hear and see real patients and hear their experiences, I think is super powerful. So I hope that resonated with you all and that some of you maybe saw yourselves represented as well. I'm going to hop back to stop sharing this one now and go back into the slides. There we go. So the website is linked in the chat now, so please do go check it out. And there's so much useful information there, bringing together over 34 patient voices to hear their experiences. The next part of this presentation, I'm going to speak a bit about what else came out of the study that I think is useful and helpful. So hopefully you find that as well. So some key findings from this study were that recurrent thrush is not the same thing as just one-off episodes on repeat. It actually is much greater than the sum of its parts and deserves attention as a condition of its own. It was something that we saw that patients needed more information about how to access services, how to understand diagnosis and treatment, and also that healthcare systems needed to see and treat as differently than one-off thrush. Something that we saw was really important was good relationships with healthcare professionals. And something that we heard many times was people feeling like they weren't taken seriously or were dismissed in care. We heard from people that when they had good care, it involved feeling that the healthcare provider was really listening to them, acknowledging their suffering, both physically and emotionally, and making a long-term plan for follow-up. So often patients found that they would call up the healthcare providers with the GP office and be redirected to the pharmacy, but that the people that got help and that got out of sort of the cycle of recurrent thrush, or when a healthcare professional was able to step in and say, we're going to figure this out together, and let's try and get to the root cause of this. Something that was surprising for many people in the study was when they learned or found out that sexual health centers were actually a wonderful resource for recurrent thrush. This is something that we saw a lot was a misconception that sexual health clinics were just for STIs. And it often wasn't until participants entered sexual health clinics that they realized that there was often specialists there who worked in vulval and vaginal pain, sometimes even having clinics dedicated to that could look into recurrent thrush as well as other underlying conditions surrounding vulval health. And also something that was really important was hearing from people that had different types of thrush, that sexual health centers could do additional testing to find out what is the type of thrush and what medication is responding to. And that's not always available in services. So it's really important to find out what your local service offers and how you can access it. Something we heard too from participants was that joining long wait lists for gynecology, which we've just seen so much reporting around, often didn't provide better care. Instead, sexual health centers were often places where patients could self-refer, could go and get an appointment, often on a short term, and get advice and testing done. Often the same day testing was also available. And that brings us into the importance around diagnosis. So something that came out of the study was a finding that not all itch is thrush. And this was something that participants felt was really important to share with other people, that symptoms of vaginal and vulval itching, burning, and irritation can have many different causes. And also was interesting in the study that recurrent thrush was sort of split off into two groups of people that had recurrent episodes that were limited. So then, within a month, you'd say, oh, I get thrush every 2 weeks, but then it goes away and I'm okay in between and it responds to treatment. But there was this other group of people that had ongoing or chronic symptoms. They often described it as a lingering sensation between the different episodes. And what we found out was that in these cases, often further investigation was needed, and that later on the participants found out that something else was also going on. And something that really helped patients was when they were able to see the same healthcare professional over time. So the participants recognized that this was really challenging to do. And for many of them, it took multiple years. But when they were able to have a healthcare professional take an active role in their care, that's when they really saw big differences. So that's something that we're going to be advocating for with healthcare professionals and making sure that they understand that recurrent thrush is not the same as an acute episode, and one that resolves on its own or with over-the-counter treatment from the pharmacy, but it's something that requires a long-term follow-up plan and often building trust around it. We also heard a lot from participants around testing. So people saying how difficult it was often to see a healthcare professional while symptomatic. So that include examples of working full-time and having a thrush episode flare up, but when you call it to make an appointment with your doctor, the only time that would work for you is in about 2 weeks. That wasn't really feasible for people, especially as they said it was really difficult to wait for an appointment before self-treating. And that led to some interesting cases where people would go and see their healthcare professional who would say, okay, we're going to swab you and do a test result. But there was problems with false negatives and false positives because people often had taken over-the-counter medication already that week, or their symptoms had gone away because it comes in sort of a cyclical pattern, which made testing more difficult. We also heard a lot from healthcare professionals about how swabs were not the be-all and end-all of diagnostics. And what this meant was that just because thrush was present on a swab, that didn't necessarily mean that was the root issue. So that might include things like having underlying health conditions like unmanaged diabetes or HIV, as some of our participants did, but also having other conditions like vulvodynia or lichen sclerosis that can present very similar to recurrent thrush, but when you dig into them, they require completely different treatment plans. So it's really important to make sure that while testing is important and having swabs done is very important, also physical examinations. And we heard from participants that these can be challenging due to embarrassment or having past trauma, whether that's sexual violence or medical trauma. But on the website, you'll hear from participants who have some of those experiences saying things that made it easier for them to get care, or how they maybe worked up to building a relationship with a healthcare professional to feel comfortable having one of those examinations done. So this is all some of the clips that are on the website, and this is really just an overview of it. But something that also participants said was helpful was asking about options to swab at home. So what that would involve is, instead of the healthcare professional doing the swab, is asking if there's options to take one home with you and do it when your symptoms flare up and when you haven't self-treated with over-the-counter medication, and returning that to the clinic. We heard from a lot of participants that they were able to have this option, but many were surprised that it was available and that they maybe only heard about it after 5 or 6 years of seeking healthcare. So we want to make sure that people know that this may be an option at your clinic and to inquire about it if you feel comfortable. And it was also important to know that not all GP services could test for the type of thrush that was present. So most thrush is caused by a certain strain of yeast, but there are some that are different. And we heard from people where they went through the cycle of, taking Canestin over and over again, but it wasn't helping. And it was only when they went to a sexual health center that they were able to have the type of thrush tested and found out that it was one that was resistant to traditional medication. So that's definitely something that if you find you're one of these people where it's constant, the medication isn't helping, it keeps coming back, and there's not periods of relief, definitely talk to your healthcare professional about that possibility. And then lastly, hearing about management. Something that participants found made a huge difference in their care was actually emollients. So emollients are creams or lotions that you can apply before you shower, use them as a soap substitute, and also use every day as a moisturizer to promote vulval health. And we heard from participants that this often made such a difference, especially when your skin was red or raw or irritated, maybe where it felt super itchy, that having emollients in your care. And we heard from healthcare professionals that this was often sort of the point where people were able to get on top of their recurrent pain enough to then look into it more, or maybe manage it enough to then get those diagnostic swabs done. So emollients are available at the pharmacy. They're pretty affordable, and you can definitely talk to your healthcare professional. They can also prescribe them. And participants found that they made such a difference in their care because healthy vulval skin is a lot able to take a lot more resilience and to be a lot more resilient to infection. So that was something that was really useful. And then also different participants had differing levels of access to medication. So we saw really large discrepancies there of people that had used everything from pessaries and creams and tablets. But we learned from healthcare professionals that recommended treatment for recurrent thrush is a long-term antifungal course of medication, often over 6 months. You can learn more about that on the website, where people who have gone through that shared what was beneficial from it, some of the challenges, and how they address them. But something that healthcare professionals noted and that we saw worked really well for patients was when they were able to trial longer-term antifungal medication, so taking it once a week over an extended period, and then seeing whether their symptoms went away and whether yeast was no longer on the swab. And that was a way to determine whether recurrent thrush was the culprit or whether there was something else going on, like maybe lichen sclerosis or vulvodynia or vaginismus that also needed to be addressed to get you the treatment and relief you needed. So these are just the high level results. And if you go to the Hexi website, it's extremely detailed. There's over 250 clips from participant interviews sharing what they learned and their experiences, their challenges, their wins, their advices. So I definitely recommend checking it out. And in terms of what's next, we're hoping to share the website far and wide. So if you know anyone suffering with recurrent thrush or unanswered recurrent pain, definitely send it to them. We also know that so many people living with lichen sclerosis, which is a vulval skin condition, are misdiagnosed with having recurrent thrush, often for years. So this is a website resource that we really have thought about with that in mind, knowing that a lot of people may be told they're suffering with thrush when really there's also something else going on, or that may be a misdiagnosis. So there's resources about that throughout the website as well. Other exciting things we have planned, as I mentioned, I am the founder of Medical Herstory, where we work to eliminate sexism, shame, and stigma from health experiences. We'll be running a media campaign to get the word out about our findings and the importance of this research, and also doing some policymaker engagement. And I will be continuing this work with a postdoc, hopefully. They'll be looking more into self-testing for recurrent thrush. So breaking that cycle of delaying care because it's hard to see a healthcare professional, and then it's hard to see them before you've self-treated because it's so uncomfortable, and then having swab results that aren't reliable, which then make it harder to get a diagnosis, to then trial treatment, and then figure out what's going on. So you haven't heard the last from me, and I just want to give the biggest thank you to everybody who's helped with this study through recruitment and sharing their story. A bit about the study's impact. I'm so honored to share this high quality resource that is full of research, and it's also reviewed by experts. So dermatologists, GPs, sexual health clinicians have reviewed the information. And we've heard from patients already that they're finding it more empowering to use their voices after seeing people share their own stories. We're also going to be disseminating this resource with healthcare professionals to make them better informed about some of the challenges that participants are facing. And ultimately, we're working to eliminate shame and stigma by talking about vulvas and vaginas, which we know are so stigmatized, and ultimately working to close the gender health gap that leaves so many people suffering in shame and silence. So thank you so much. The website is linked in the chat, and I'm really happy to take any questions as well. Oh, I think you're muted.
I'm mute because I don't have any sounds from here. But listen, that was brilliant, Tori. And we do have some questions that have come in. We've got thank yous that have come in as well for covering this. And again, that importance of patient stories and how other people can be empowered to, yes, we can talk about vulvas and vaginas and our genital areas, and if there are problems, for us to go and seek help. One thing you said really early on, I just wanted to check. You said 6% of people worldwide experience recurrent thrush. Should I get that right?
Yeah.
Is that? Wow, I had no idea it was that prevalent. And that there are different types of thrush that would mean different types of treatments. So yeah, I think important for us to know. I've jotted down lots of questions, but let's go into what other people have been asking. Shilpa, yes, you asked where can I access the module. That is the link that we've shared, and we will share the link from our website as well on our socials as well. Again, Megan says that was really helpful. Thank you so much. Philippa says, why are there so few second-line drugs for azole-resistant thrush? I'm finding it so hard to get hold of niacin pessaries. GP can't get it. Consultant gyno can't get it. Thrush is just treated so blasé in traditional medicine, but it can destroy your life.
Totally. So that's something we did hear from both patients and healthcare professionals with so much frustration. So what this question is getting at is that when people are diagnosed with a strain of thrush or a type of thrush that isn't the regular one, putting in air quotes, or the most common one, the medication that's available is actually quite limited. And we've actually seen the discontinuation of medications over the last 5 or 10 years, where things that maybe would have helped patients are no longer available. And we have seen GPs finding it really hard to access some of these medications, like nystatin pessaries being one of them, and even sort of interesting dynamics where, based on how they're coded for healthcare professionals, sometimes sexual health would have to prescribe it on behalf of a GP, or maybe having to talk to gynecology. So this is a really, really big issue that came up in the study and we'll also be addressing in some of the papers. But yeah, and I think it is, Philippa, getting at your question around it being treated so blasé. We really saw that with recurrent thrush of it's just thrush. And actually it's not. It's a really impactful condition. If you go to the tab that's about emotional impacts, how people, put off having families because they couldn't have enjoyable sex from it, and, had to take time off work or found themselves, not feeling like themselves for years. So there's lots of stories like that. And I think access to treatments is so important, and treating this like a serious condition as well.
So the discontinued medications that might work for some people, I mean, is there somewhere that people might be able to pick that up, or are they completely discontinued?
I spoke to a few healthcare professionals that are doing work trying to get a hold of them and trying to sort of campaign to bring them back. So nystatin pessaries are more difficult to get a hold of, but those have not been discontinued. So definitely, right. I know it's frustrating, but hopefully, I know, like we heard from healthcare professionals, they want to help patients, of course, and they're doing their best to secure some of these, but they're facing a lot of difficulties accessing them right now. So I'm hoping to have more positive news to share on that, but just know there are people who have influence trying to do their best to make a change there. But it's when you ask them why it's happened, it's because, it's not seen as maybe an important issue or something that's profitable, or many different reasons.
Okay. I think it was important for people to hear that they don't necessarily have to wait for a referral to a gynae clinic, and that may not even be necessarily the right place either. They can just self-refer to a sexual health clinic and be seen maybe same day or much sooner.
Yeah, definitely. We know the wait times now for gynecology are really large. I would say the one wait list I think is worth getting on is for a vulva dermatologist if lichen sclerosis is suspected. So if there is changes in the the vulval structure, if there's any white patches, thinning of the skin, cracking of the skin, or if this is something that your healthcare professional has raised. Lichen sclerosis can affect people at any age. So definitely, I think if that's something you are worried about, bring it up, and a vulval dermatologist is an expert in that space, but also sexual health often has specialists as well, and your GP might have a special interest in it, but that I think is worthwhile. But gynecology, what we heard from patients and healthcare professionals was that it was often the same advice they'd be offering. And then with the treatment options, sometimes even with referrals up, they didn't have any secret magic pills. It was often the same. And often people found that frustrating of, waiting years often to see somebody and being told the same advice. So we definitely recommend sexual health clinics if they're available and accessible to you.
Yeah. And again, please do check your vulvas, because of course you're not going to know whether there are changes unless you know what your vulva looks like. So just sit, legs wide open, use a mirror, check your vulva out on a regular basis. So if you see any changes, you can go and get that seen to and see a vulval dermatologist and see whether it's lichen sclerosis or rule anything else out. Just taking, you mentioned emollient, Epimax, there's, others as well, different ones work for different people. So Epiderm or Hydromol, these are alternatives, but you can and they are over the counter. They are low cost over the counter, so you can just go and wash the area with that, and also moisturize with that can be good too. Megan asks, what's your opinion on probiotics for prevention, either vaginal or oral supplements?
Yeah, so the participants we spoke to had really mixed experiences with this. So some people found probiotics helpful, some people found they weren't, but what everybody said was that they were very expensive. And I think that's something to keep in mind, especially when currently there's not enough evidence to say whether they do or don't help with recurrent thrush. And healthcare professionals as well had sort of mixed views on it, of whether it was something that, people were desperate and spending so much money to have probiotics and it actually wasn't helping. But then other people said, it was the one thing that did help them. So unfortunately, there's not enough evidence to say either way. And I think I'm not a clinical trialist, but we do need more clinical trials in the probiotic space for sure. So I think, you can head to the website to hear people's experiences with it and then decide for yourself.
Okay. What else did I see here? Why do so few gynos who specialise in thrush know the link to nerve damage and vulvodynia?
Why do so few of them know the link?
Yeah. Is there a link? I mean, yes, there's a link to vulvodynia in terms of that it's vulval pain. A link to nerve damage with thrush, recurrent thrush?
Might be getting at what I heard from some participants was understanding or being told maybe by a health professional or reading online that recurrent thrush had sort of damaged, well, I don't want to say damage necessarily, but hypersensitized the area, leading to conditions like vulvodynia. So having nerves that were hypersensitive. So then when things like cotton underwear or toilet paper or touch felt really aggravating. So some people, unfortunately, when recurrent thrush was resolved, had sort of lingering symptoms over time. And that's something that's really important to note. And I'm glad that we're talking about is that just because something was thrush at one point doesn't mean it still is. And that's why I think it's so important to try and stay engaged with healthcare professionals. And I know that from my own experience, finding ones that, you feel comfortable with or that you trust takes time. But when you do, it's so worth it because then you can have that follow-up conversation of something's feeling different now, or the symptoms are more chronic, or they're lingering, or it's not responding to treatment how it used to. And like was said, making sure that you're looking at your vulva so you can see any changes is really helpful. But we do know that recurrent thrush has links with vulvodynia, whether it's co-occurring or causative. There's different studies on that and those linkages. But I do think it's something we need more awareness about so that we don't keep throwing antifungals at something that maybe is no longer caused by thrush.
Catherine has said, I'm assuming this is Catherine in the background, saying one study in mice gave recurrent thrush infections to them, which were then treated, and then some of the mice developed vulvodynia as a result. I mean, I certainly would have something to say on that. I'd be interested in what state that those mice, their nervous system was in prior to them being given thrush, because if there was already a predisposition to sensitivity, or things were already highly sensitive or upregulated, then it's more likely then that vulvodynia might then be ongoing for a while. Yes, this is Catherine. Yes, Catherine, I thought it might be you. Okay, let me just have a look. I think there was something else. Sexual health centres can often be found in your local hospital.
Yeah.
And repeated vulvovaginal fungal infections cause persistent pain in a mouse model of vulvodynia. I'd like to know how old that study is, Catherine. I think that's important for us to know as well. We have come a long way with regards to what we understand about why things can linger. But treating recurrent thrush, you were saying that treating this as a condition in its own right rather than like standalone thrush, what makes it different apart from the fact that someone may get it 4 or 5 times a year?
Yeah. I think there's so many dimensions to it, one being sort of the social and emotional aspect to it. So we heard from people that, if you've thrush one off or, a few times a year, you might feel a bit lousy. You might have to take some time off work. You might feel like, you don't want to engage in sex. It's really painful with thrush. We don't recommend it. But when it becomes something that's recurrently happening, we saw it take up so much mental space for people. So not only while they were having flare-ups, but also in the periods of, oh no, have I eaten too much sugar today? After having sex, I have to go wash right now, being really concerned about activities like swimming, like so many things that people had to consider, or giving up cycling or different activities that they enjoyed because they were worried it was causing or contributing to thrush, and it really impacting their lives. Like I said before, damaging relationships, making people concerned about their fertility or having children. We saw a lot of anxiety around that. There's sort of no links between thrush and it affecting fertility, but more so people that didn't want to go on dates, they didn't want to put themselves out there, they found themselves more isolated, and also a lot of feelings of, it's a condition that I think there's so much stigma around, of feeling like you're gross or you're dirty or you're undesirable. So that I think is very different. And then also in terms of the diagnostics, I think. So if it's one-off thrush, I think you can safely safely treat that without testing for it. And that's what the guidelines recommend. But when it is recurrent thrush, you want to know, one, is it thrush? What's the type of thrush? And then is there anything else going on? So I think that's really important, and the sort of ongoing engagement with healthcare professionals that's needed. While acute thrush, I think is very adequately managed within pharmacies where there's nothing going on. But when you have those lingering symptoms, it's definitely worth inquiring into, is there something causing this, underlying an autoimmune condition, or is there also something else with the vulva going on?
The at-home swab that you mentioned that you can ask GPs for, is that available at all GP surgeries? Do you know?
No. So something we saw with the study, we talked to people all across England, so both the patients and healthcare professionals, and there was a lot of difference in terms of services, what they offered, what they were funded to do, what they were able to offer for patients. So it's hard to recommend, go to your GP and this will be available. We can't guarantee that, but it's worth asking about, is it an option? And if it's not an option at the GP, maybe it's an option at sexual health. And we also heard, GPs being really having other accessible options. So if you are symptomatic, you can do the swab yourself at the clinic. So instead of having to have the GP do it, if that's something you prefer, but being able to do them at home was really seen as a solution if you weren't symptomatic that day, but there was something going on with the recurrence that you just hadn't been able to catch on a swab yet. So we definitely heard it being available in a lot of clinics, but again, you have to explain that it's recurrent thrush, because if you say it's thrush or it's acute thrush, often they can't swab for that. They have to know that it's recurrent, and then they're allowed to treat it differently, if that makes sense. So letting healthcare professionals know you're struggling with it, being as open and honest as you can about how often you're getting it, and then asking about if there are any options to swab at home is helpful.
Great. So we're almost coming up to the hour, and I wonder whether we can wrap up by, was there something that patients really wanted healthcare professionals to know or understand? Were there one or two things that they agreed upon?
Yeah. Oh, there's so many, because there's a whole web page to it. But a few that really stood out were wanting collaborative care. So wanting to feel like they were a team, wanting to feel like they were taken seriously, that their condition was important. There's a beautiful quote from one of the participants who said, after 10 years of struggling with this, they went into a sexual health clinic, and the doctor said, "I'm so glad you're here. I'm so glad that you're here so I can help you." And sort of that dynamic of feeling validated, feeling seen. And then people sharing that, when that happens, they were saying, you know, I haven't had recurrent thrush now for a year, but if it came back, I'd feel confident to go back and see my health professional. I know I'd be taken seriously. I know that I'd get the help I would need. And I think we see firsthand how much that makes a difference, and also sort of those small changes from healthcare professionals. So not saying things like, oh, it's just thrush, but really asking about how is it impacting your life? Is there anything that you want to talk about in terms of that? I think being comfortable talking about sex, asking them how it's impacting them, because we know from participants it's having a massive impact, and then being able to communicate that, and then hopefully getting on the right treatment course and feeling heard. But really, I think more than anything, people just wanted to be taken seriously and not told that, oh, it's just thrush, you can self-treat that over the counter, but knowing that, you know, oh wait, I hear recurrent thrush, let's put you on a bit of a different path that entails follow-up and entails longer term care.
And a follow-up, but hopefully with the same healthcare provider.
Ideally,
So that
we know it's so difficult, but people that were able to have those relationships with a trusted health professional, that's so invaluable. And if that's not available, what patients found really helpful was treatment plans. So putting in the notes, you know, I think it's thrush. We're going to trial a fluconazole or a canestin tablet for 3 months. If they still have symptoms, please, you know, then pass them on to sexual health or something, just creating a plan with them. So then somebody else can follow up there, but they know what you're thinking. And when that didn't happen, patients found themselves going back in and being told, okay, we have to swab you. And them saying, I did 3 swabs before, where have those gone? When it's not sort of documented or followed up, or when patients also are going between systems. So there's not always note sharing between sexual health and GPs. So important to know that as well, that you might have to fill some of those bridges yourself as a patient.
And that thing of being seen as a human being, as a whole human being with a life to lead, with your own values and priorities. And so just that question of how's this impacting your life, you know, what's important to you, rather than just being treated as a body part, can be so important for someone, just to be seen as a person.
Definitely. And I think what we heard too was, you know, not promising that it's going to go away overnight. And I think people were really appreciative when there was more of an honest conversation of this might take some time, it may take some trial and error, but that they weren't in it alone was really impactful.
Brilliant. And Catherine has said it was Melissa Farmer's study that was repeated vulvovagina. Vulvovagina was getting a bit late. Fungal infections caused persistent pain in a mouse model, vulvodynia, back in 2011. We may need to get Melissa to on a live stream to see whether she's what she's working on now, whether she's kind of updated anything. Tori Ford, that was absolutely brilliant. Thank you so much. We've got lots of thank yous coming in the comments on Facebook and YouTube. And of course, we will share the replay as well on our socials. And listen, if you joined late, because I did notice that the numbers went up about halfway through. So if you missed any part of this live stream, you can rewatch the whole of it. And all the other live streams we've done over the last few years on our Facebook events page. We will share the link. Well, if you're watching on Facebook, you'll see, actually, I'm just going to just paste up the Facebook events page as I'm talking. That's coming up now. And of course, on our YouTube channel is our full playlist of around about 50 or so videos now. So go and check those out. And we've covered pretty much everything you can think of. Of course, we've had Tori on a couple of times. We've covered best practice in treating vulvodynia, multidisciplinary care, preparing well for appointments. Physio, of course, we've covered a number of times. Vulval skin conditions, lichen sclerosis, covered by Liz Venner and Karen Gibbon a couple of times. Psychosexual medicine and intimacy with vulval pain, pain science calming the nervous system, supported self-management of pain, menopause and pain, loads more. Go and check those out. And if you have any questions about vulval pain, You can find resources on our website. That's vulvalpainsociety.org.uk. And we will have a link to your website as well, the Hexie website as well, Tori, so people can access it that way. Or go to those videos with the specialists I mentioned earlier on our YouTube channel. You can also reach out via info@vulvalpainsociety.org.uk. We are a small team of volunteers at the Vulval Pain Society, and we all work in some capacity as either in the field of pain with patients and in clinical training. So please bear with us if you get in touch. We may not reply as quickly as we want, but we will reply. We will get back to you. Keep an eye on our social media pages. So we post info updates on there. We're on Facebook and Insta. We're not on Blue Sky yet, but I have started posting Vulval Pain Society events on there. Search for me there, and if there's enough of you on Blue Sky, I'll set up a dedicated Vulval Pain Society account. We are a tiny team, as I say. So wherever you are on social media, we appreciate you liking and sharing our posts. It means that we can get resources and messages out to more and more people. It gets those messages out to people who may be experiencing vulval pain of any kind, and also the healthcare professionals treating them. So please continue doing that for us. That is all from us today. Keep an eye on our socials for the next Vulval Pain Society Live. Thank you again, Tori Ford.
Of course. Thank you so much.
And we're really looking forward to hearing what you're going to do with your postdoc as well. So watch this space, everyone. And thank you all for being with us live or on the replay. Bye for now. See you next time.